Menopause affects millions of women each year, bringing changes that can impact everything from sleep and mood to skin, overall quality of life. So today, we're joined by nurse practitioner Caitlin Bump, director of wellness at Facial Aesthetics, to discuss how hormone replacement therapy can help women navigate this, sometimes scary transition when things are happening to your body and you don't know what to do, where to go. Let's talk a little bit about HRT. What does it mean? How does it work?
Yeah, HRT, so hormone replacement, that is providing a predictable level of hormones back to a woman who has gone through a transitional period where they're no longer making the same amount of estrogen and progesterone that they've been used to making for, 10, 20 years.
When patients come to see you, what is like the most common symptoms that, women are complaining of?
Yeah, so there's a lot of symptoms that women complain of, more so than just hot flashes. That's kind of what you typically hear of.
Right.
However, we have estrogen receptors on pretty much every single organ of our body. So when those receptors are no longer being stimulated, it makes sense that you're going to start to develop new symptoms. So things like brain fog, things like joint pain, sleep disturbances, mood swings, weight gain.
Wow.
You can even develop itchy ears and itchy skin, believe it or not, because of that lack of estrogen.
I've never heard of that one.
Yep.
Wow. Okay, so who would you say is a good candidate for this and how does it work? Is it injections? Like, give us all the details.
Yeah, so hormone replacement, it's a very individualized decision or process. So it's something that as a provider, I work very closely with women to review their medical history, review their overall symptoms, what they are hoping to get out of treatment. And then together we jointly come up with a treatment plan that's specific and safe for them. So hormone replacement can be done in multiple different methods, different routes. So we have patches, we have pellets, we have pills, we have
wow.
creams, we have mists. There's tons of options. And again, all of those decisions are going to be made based off of that patient's specific needs.
That's incredible. And sometimes a combo of those things can
Absolutely.
work as well.
Absolutely.
Nice. Any risks or anything that women should be maybe concerned of or side effects, those sorts of things?
Yeah, absolutely. So anyone that has had a history of hormonal-driven cancers, that is usually a contraindication to hormone replacement. However, we have lots of options to help during this transitional time in life that aren't just hormone replacement. So things like GLP medications to help with metabolic optimization. We have things to help restore collagen, which we know decreases after menopause. So even if somebody isn't necessarily the best candidate for hormone replacement, it doesn't mean they have to suffer during this transition period. What I love about Facial Aesthetics is we have so many tools in our toolbox to really help support women during this period of life.
That's good to hear. As a provider, how does it feel when women come and like, thank you, thank you, Caitlin, you helped me. And that, it's
Absolutely.
hard to get that relief sometimes.
Absolutely. It's super rewarding. Unfortunately, women oftentimes feel like they're kind of gaslit by their providers when they mention hormone replacement. And so when they are able to find a location where they feel safe, they feel comfortable, and get the care that they need, they often tell me, oh my gosh, I have my life back. And it's amazing how just offering, some hormone replacement can really, truly give a woman their quality of life back.
That's empowering.
Absolutely.
Caitlin from
Absolutely.
Facial Aesthetics, thanks so much for being here.
Thank you. I appreciate it.